Hi, my name is Micah Lenny Zell, and I will be talking to you today about predictive sepsis analytics. So I first want to start out about explaining a little bit about sepsis. Sepsis is a significant, life-threatening infection in the body that can re-regulate the body into pain and cause it to work improperly. This can lead to septic shock and decrease blood pressure to a dangerous number. This will cause severe damage to the organs and then lead to death. Predictive analytics, which artificial intelligence fuels, aids in the early detection of sepsis. Integrated into that aid is the EPIC sepsis model that is used within the EPIC electronic health record. The EPIC sepsis model is exceptionally beneficial in clinical decision making. It helps reduce the number of deaths from sepsis. To monitor the accuracy, implicit bias, and integrity of this model, it must be addressed comprehensively. This presentation will review the EPIC sepsis model and its impact on the real world, including trade-offs and practical implementation strategies for optimal results. This presentation will also go into detail about how this model has impacted the nursing world. It will look over risk and benefits and end with a reflection. For the first research component, we will look at a study that was done. The EPIC sepsis model was used in a before and after study to compare the baseline of a patient and the intervention period. The setting was an urban 746-bed academic level 1 trauma center. The patients who were in the study were adult acute care inpatients. The research was based on an alert system that was activated by scores of 5 or greater. The set point determined using receiver operating characteristic curve analysis. This study was created to understand the device in the setting of the hospital and how much it would benefit the patient and not just the healthcare team. The study showed, as a screening test, the ESM has sensitivity, specificity, positive predictive value, and negative predictive value rates of 86%, 80.8%, 33.8%, and 98.11% respectively. The study demonstrated significant results, leading to the conclusion that the test effectively reduced the likelihood of dying from sepsis in the hospital by 44%. This study has shown that the EPIC tool is vital and can help save lives and reduce sepsis mortality. The EPIC sepsis model is beneficial for data integration and hospital workflow. Nurses can receive alerts when a patient is at risk of sepsis-related danger. One significant addition is that EPIC facilitates documentation and communication among nurses, doctors, and patients. The EPIC provides scores and alerts that help the healthcare team collectively understand the patients. The model is quicker to catch how the body is responsible to sepsis than a human. Patients will experience a better quality of life due to EPIC, resulting in faster treatment and a decrease in mortality. It is crucial to always be aware of the benefits and risks associated with using new equipment. These advanced AI algorithms can detect patterns that are not intentionally obvious to the human eye. Namati raises a valid point that humans can only perceive so much and absorb a limited amount of information at a time. The EPIC model can catch what humans may not be able to. It is equipped to lean in and understand whether the complication the patient is experiencing is due to other complications rather than sepsis. Another benefit is that the study reported a 44% decrease in mortality. Some risks can include accuracy issues. False alarms can occur, leading to unnecessary work and lab tests for nurses and doctors. Ethical considerations. HIPAA violations are another issue that remains unresolved. This is sensitive information that needs to be stored and kept private. However, we do not entirely understand who can access it or how it is stored. Biases can also cause an ethical issue within the system. We are unsure if that plays a role in determining which patients might be helped faster than others. Liability is another moral issue that we must consider. Who is liable if the system misdiagnoses or misses a severe case of sepsis? Would it be the model, the doctor, or would it be the hospital? It is hard to tell and can become complicated and expensive. These risks and benefits are substantial to note when using the EPIC sepsis model. For the reflection questions, I was asked 2 questions. The first one, would I personally use or trust this tool? Why or why not? Based on the information and evidence I have gathered about the EPIC sepsis model, I would advise using it with caution. This means that I believe there should be safety measures and regular audits for the hospital. Safety precautions include constant monitoring of performance and having a team that explicitly checks the tool to ensure it is not experiencing technical difficulties. I would like training and audits to improve my use and understanding of the tool. How can nurses shape AI design and evaluation? Nurses should provide an honest opinion on alerts and the usage of the tool, and state how alert fatigue has affected them. Additionally, they should be included in research and studies to ensure the tool is accurate and equitable. As nurses work directly with patients, a nurse should work firsthand with the ethics board to ensure the privacy and accountability of the tool. This ensures that patients are being treated fairly. In conclusion, it is essential to remember that, regardless of any new machine or tool introduced into the healthcare practice, it is crucial to recognize the ethics taught in school. Each patient matters and should be cared for in a way that represents and honors God. He made us in His image, and as a Christian, I strive to care for my patients in a manner that reflects Christ. Thank you so much for listening.